Hello, everyone, and welcome to Iapmd's Year in Review. We're going to reflect on 2021, and we're going to refresh by looking forward to 2022. I'm Sandi MacDonald, co-founder and executive director of Iapmd.
And I'm Sheila Buchert, president of the board of directors. It's such a great opportunity to come together like this and talk a little bit about all the amazing accomplishments we've had during 2021. So first, we're going to reflect a little bit. One of the themes that we used during PMDD Awareness Month was that many hands make light work. And we certainly could not have done what we've done this year without all the many hands that came together and worked together to make these accomplishments a reality. One of the biggest things we did this year was we received funding from the Patient-Centered Outcomes Research Institute. That funding was to be used to bring the patient experience and voice to the PMDD conversation. And we used those resources to truly help build Iapmd's visibility and credibility. The PCORI work helped us build communities. We built a patient insight panel, we built a professional perspectives panel, and most importantly, we built a global PMDD community coalition. We also did research as a part of our PCORI work. We did a selective literature review, we did a patient study, a provider study, and a care partner study. And all of these studies and presentations reviewing the findings of these studies are available via our website. And most importantly, we hosted the first ever PMDD Global Roundtable. On July 16th and 17th, we brought about 40 people together virtually, members of our PMDD Community Coalition, patients and experts alike, to the table where we discussed and deliberated PMDD. And the outcomes from that roundtable were that we're creating a strategic plan for patient-centered PMDD research, and we're also putting together a guide to effectively conduct rigorous patient-centered PMDD research. Both of these resources will be available at the first of the year through our website. In addition, we've helped so many other people. More than 450,000 folks have visited us via our website. We helped over 31,000 with our peer support groups online. We've emailed to our subscribers, which is up to over 21,000, and we published almost 2 blogs every month, 21 blogs total this year. We also did a lot of new firsts. We launched a professional community, 2 professional communities actually, one for clinical professionals and one for research and scientific professionals. We launched an Iapmd Podcast series. We began our video peer support groups, and we're doing sharing sessions and socials on an exciting platform called Kumo Space. And we've also been published this year. In the Journal of Women's Health, we published our patient experiences of healthcare providers, and we have submitted for publication an article on suicidality as it relates to PMDD. We've also advocated. We issued a position statement to support a new global definition of menstrual health. We worked to help inform the work of the UK Women's Health Strategy. We worked on curriculum with the state of California through a group called FemTruth. And we've also submitted statements for the treatment of the women in Wales. And yes, we grew. Our funding support was up over 19% over 2020. And we've grown in connections through our community coalition, our patient insights panel, and even some new ambassadors. But looking forward, what are we going to think about and do in 2022 and beyond? Our focus for 2022 is sustainability. We want to sustain the organization by growing our people, our profit, and our purpose. Early next year, we'll be convening a work group to work on our strategic plan. Our current plan takes us through the year 2021. Our new plan will take us from 2022 through the next 3 years through 2025. And this plan will hopefully begin to move us from awareness activities to much more action-oriented activities. And this plan, again, will be built around our 5 core priorities that you can see here. In the care and support priority, we're going to focus on building our people by hopefully bringing on board paid peer support providers. We're going to fund this by growing grants to fund our care and support work. And we also are investigating the opportunity to expand our program by adding a navigator element for newly diagnosed patients. In education and awareness, we again need to grow our people. We want to grow our professional communities, and we want to continue to keep our PMDD community coalition alive and expand our engagement with those coalition members. To support this, we're going to look to memberships and sponsorships. And we, of course, always want to be expanding our channels and the content that we deliver through those channels. In the research arena, our focus will be on expanding collaborations and getting more patients engaged in the research process. We're going to look for funding for this sort of work through grants and perhaps more PCORI grants. And we hope that in the future, we will be focused on disseminating the findings of the research that we conduct, as well as research conducted by other entities. In advocacy and public policy, we're going to focus on recruiting volunteers that have true advocacy experience, folks that have worked with government agencies, lawmakers, and the such, so that we can really begin to build a full-fledged advocacy program and then a network of trained advocates. And in the funding arena, our focus is going to be on a variety of approaches, but also on looking for major donors, corporations or individuals or such that have deep pockets and really a passion for our mission and our issue and want to help fund our work as we go forward.
Thank you, Sheila. What can you do to help us to sustain our work? Join the light. If you go to our website, it's the opening page on the website, and you can learn more about it there. On behalf of myself and Sheila and all of Iapmd, we would like to thank you for helping us have such an awesome 2021, and we look forward to seeing you all in 2022. Happy New Year, everyone.